Video.
Okay.
So this is her CT scan. Have you guys seen her scans?
No.
No? Okay. So this is the front, and we can show you too. Okay, later too, if it's too much to see. Front, and then this is the back, right side, left side. So just imagine she's lying on the table. Her feet are out here, and she's looking up, and the top of her head's this way, and then we're taking slices through the picture towards the top of her head. Okay? So this white is all her bone. Okay, and then this is kind of like soft tissue neck, and we're moving up towards the top of her head here. And we can see already here, and this right frontal and left frontal, and even in her right temporal lobe, she's got some bleeding. So this white bit is hemorrhage or bleeding, and that's because she really knocked herself down. Okay. These areas can affect your memory. Okay, so probably in about 2 months, 2 to 3 months, I'm going to recommend that she see our neuropsychologist, Dr. White. She's wonderful, to kind of do some more intensive testing for her cognitive and memory to see what we have. And then one of the things that can happen with these frontal lobe injuries is that they can become disinhibited. So like a thought pops into their head and they just do it.
Okay.
Like getting out of bed even though they shouldn't, saying something that's inappropriate.
Okay.
Just a thought just hits.
And it comes out.
And it just comes out.
Okay.
Yeah, you know, or they just do it
Okay.
without any
It
thought.
could be verbal or behavioral.
Yeah.
She
Okay.
has a hard time hearing.
Okay, yeah. So, yeah,
I think she'll explain it to you again when you
Yeah.
hear Judy.
yeah.
Okay.
So, and then also she's got a little bit here on that left. And then we go a little bit higher, and then it's essentially, she's got a little bit of a subarachnoid hemorrhage when we talk about that, and then a little bit of a subdural here. So subarachnoid here and subdural. I don't think these were causing any issues.
Okay.
But the reason why she can speak so well and she can move everything well is because the centers of the brain that controls the motor or being able to move and our speaking aren't affected at
Great.
all.
Good.
Yeah.
Great.
So that's why she can hear, she can talk, she can move around, do all those great things.
Okay, so it's memory and then this sort of impulsivity.
And maybe some personality changes.
Okay.
She's a little bit more irritable, a little bit more apathetic towards things that she would normally care about. She might not care about, but we're not going to know how this essentially brain injury is going to affect her until when we're closer to about 2 to 3 months out
Okay.
from today.
Okay.
Yeah.
I know that. Okay.
Yeah, so that's why it's important that we have her follow up with Dr. Cassie White for
Okay.
that intensive testing.
Okay.
Yeah.
Okay.
Okay. And so, it's important that you guys know.
It is. Thank you.
Yeah.
Yeah, that was very clear. I don't
Yeah.
have any questions. Do you?
Yeah.
No,
Okay.
And then so we just need to make sure that she because we have this bleed, we just want to avoid like blood thinners, like aspirin, Plavix, other things. In the future, maybe like 6 months from now, she can be started on it. But right now,
Okay.
we're gonna just avoid
But
it.
you understand that she has a heart condition.
Yes.
Okay.
Yeah.
All right.
So in the future, absolutely, can restart it.
Yeah.
But
For now, this is more important. We're addressing this first, and then
Yeah.
we'll go back on those
yes,
if that's the right answer.
exactly. Yeah, because she's gonna need to go back on it,
Okay.
but we just can't restart it super fast.
Okay. Yeah.
We just have to let the brain heal itself.
Okay.
And then another reason why I think she's having those twitching on the right, because this area on the left, the blood is very irritating towards the brain, so it creates little tiny electrical storms
Yeah,
or
it's
overactivity.
Mhm.
And so she was probably having what we call partial seizures,
Uh-huh.
and the left affects your right side of your body, so it totally fits with what's been happening, and that's why she needs to be on the Keppra right now. Eventually, she might not need to take that medication, maybe in like a year or 2 years. We can talk with her outpatient neurologist, who you guys will get established with, to maybe wean her off of that medication, but I'd like her to be on it for at least a year to prevent any of this from happening, or
Okay.
any seizures from happening.
Okay.
Yeah.
Okay, so the bleeding,
Mhm.
it's still there.
Yes.
Is the body
Will slow,
absorbing
yeah,
that?
this body will slowly absorb, but it takes weeks to months, and then we'll always probably see some evidence of that old bleeding, and then eventually, you know, as time goes on, when we do repeat CT scans, we'll see how much of the trauma of a brain injury she got later. Yeah, it'll
So-
be what she gets repeat scans, it'll say encephalomalacia. Yeah.
Okay. And are we seeing the results or the presentation of these symptoms right now, or are they to come? Or both?
So both. Yeah.
Okay, so her memory could get worse, or
Yeah.
her
and
person
she's
like okay.
yes, and she's gonna be at high risk for what we call hospital delirium. Just being in the hospital, it just not
Yeah.
sleeping well. It
I
just
know
makes
that.
you weird.
I unfortunately know that very well. Okay.
Yeah, and that because she's had this traumatic brain injury, she's not. If she does develop that, she's not gonna come out of it very quickly, like weeks to months.
Okay.
Yeah.
Okay. So what's her trajectory here?
So we're monitoring her. We have to get clearance from neurosurgery to get her out onto the floor, and then we'll have PT, our physical therapy, occupational, and our speech therapist or specialist, and kind of evaluate her and determine the best place for rehab. Because after we get her out of this acute phase, those rehabilitation things, PT, OT, speech, are going to be super important for her.
So do you think so we'll go upstairs is what I've heard.
Yeah, it's the 6th floor.
So
upstairs.
6th floor,
Uh-huh.
like today, tomorrow, we're not
I don't
sure.
know. There's a whole team of doctors,
Okay.
so we all have to kind of confer. But usually we monitor them in the ICU for at least 24 hours. Once they hit that 24-hour mark and everything is stable, then we can send out.
And then how long do you think she'll be upstairs in the hospital for?
It just depends. You know, hopefully no longer than another day or so. But it depends on what those evaluations from those specialists say and what they're
Okay.
recommending. And then if they do recommend like a certain like rehab center or like a subacute place, case management specialists will come and talk with you about your options. You can go visit those places.
Yeah.
Lots of people will help you make those decisions.
And I understand
Yeah.
you don't have a crystal ball, but like what I'm hearing is she's probably not going to be in the hospital for 3 weeks up there.
No, but she might
She's-
be in rehab for 3 weeks.
Okay. And then
Yeah.
after that she goes home.
Maybe not. So
Okay.
at the
I
end of
see.
that rehab, she'll have continuous evaluations because we got to make sure that she's safe.
I hear
So
you.
if she's like super impulsive and
I hear you.
she may not be safe.
I get it.
Yeah.
And that might present itself that is going to present itself over time. So it's just constant evaluation from here on out.
Yeah, and
for
that's
her
why
safety.
and that's why we have those PT, OT, speech people, those
Okay.
specialist evaluators.
And that
Yeah.
starts upstairs.
Yes, actually, it started here while she's been here.
Okay,
Yeah,
okay.
Yeah, we started it right away because that's super important.
Okay.
I know it's a lot. It's a lot. That's why I have people take videos.
I
'cause
thank
it's
you for
too
that.
much.
Thank
It's
you.
too much.
Yeah, no, I appreciate that.
Yeah.
Okay.
Yeah.
All right.
Yeah.
So she's been in the ICU since Sunday morning.
Oh, okay. Yeah.
So maybe she'll be able
yeah.
to change rooms at least or
Yeah.
something.
We'll see what everybody agrees on. So it just kind of depends.
For the hospital delirium, are you thinking that's might set in upstairs while she's here?
Yes. Yeah. It usually
And then
most commonly it usually happens by like day 2, by day 3. Usually, if it's gonna happen.
And then that would carry over to the rehab?
Yes, it could.
And then, okay. All
And
right,
even
I understand.
longer, and even longer, absolutely. But when it happens and she's saying kind of like weird things that aren't making sense, it's okay. We just make her reality fit for her. We love you. We're safe.
Yeah.
We're taking care of you. Oh, it's 1950s. We'll play 1950 music.
Okay.
Oh, someone stole your purse. Yeah, they caught that guy. That was terrible. Here's your purse.
Okay.
Yeah, we won't like. We just
Okay.
kind of focus on safety and making them calm and their reality fit for them.
And I feel like that's the third time I've heard a physician say in this room, keeping her calm is important.
Yes.
So like when she is agitated, not being emotionally responsive to that, just
Yeah.
nice and calm.
Yeah. And
Okay.
even though they are confused and they might not understand the words, the tone is always there.
The
Like
tone.
the happy, calm tone, they always understand that.
Okay.
Yeah.
Okay.
Our primitive brain will never let go of that.
Okay.
Yeah.
It's high dysregulation. You're helping her regulate, stay cool and calm. Okay. Got it.
Yeah.
Thank you.
Yeah. It's hard. So it's important to bring in lots of people all at once. That's why we have all the specialists, case management, social workers, kind of help you with the process.
Do you expect that to happen? Like, I understand the
I
hospital.
don't. I don't know. So
You don't know.
it
Okay, this is just a possibility.
Because of the brain injury, it's a high possibility. And then just anyone being in the hospital for any length of time, the delirium in itself is it's a possibility, even without a brain injury.
Okay.
Yeah, but because she's had the brain injury,
Okay.
the risk of it's much higher. So I need to prepare you
Yeah,
for if it does.
I
happen.
understand. Okay.
Yeah, so you can be like, oh,
we talked about this,
yeah,
and
it's
I
not
understand.
right.
Yeah.
Even though while you're in it, it's still gonna be emotionally hard to deal with. But at least the fear of it will be taken away.
Yeah. Yeah. Okay.
Okay.
Mhm.
Sorry, that's a lot.
It's okay.
But we got a video.
We'll see. Yes. Thank
And
you.
if you need to send
Should
that-
I turn it off? Is it
It's
good
up
to
to
be
you.
off?
It's